Hi everybody, it's time for your Farm and Ranch news. Well, as the coronavirus continues to devastate our agricultural markets, without question, COVID-19 is also affecting our rural communities. Alan Morgan is the Chief Executive Officer of the National Rural Health Association and recently talked with RFD TV about the virus and what it means for rural health and some of those actions that we should all be taking.
Right now, the real concern from a rural perspective is capacity. Our rural hospital is able to handle a potential influx because, as you know, this is cold and flu season, and many of the nation's rural hospitals currently are operating at capacity. So that's the concern. But the good news is, of course, our hospitals are prepared for this. They've been drilling for this, and they are receiving daily updates from both the Department of Health and Human Services and the Centers for Disease Control on updated protocols of how to deal with this new virus.
Now, he says to help prevent the spread of the COVID-19 virus, common sense is very important, and this includes doing simple things like just washing your hands, the elderly taking some extra precautions, and calling the doctor and/or hospital before you go, and being careful when traveling to heavily populated areas. Well, stay with us. We'll have more ag news right after this. Well, continuing his efforts to help curb the growing number of farmer and rancher suicides across the country, Montana Senator Jon Tester has pressed Agriculture Secretary Sonny Perdue on his agency's efforts to address the growing crisis. Tester, who, by the way, recently introduced his bipartisan Seeding Rural Resilience Act to address the farmer suicide crisis, has been working to get the USDA to make strides towards tackling mental health problems here in rural America.
It's not good in farm country. It's not good. Prices aren't good. Folks are getting taken advantage of by packers. It's an isolated population anyway. A lot of times there's not a lot of folks out there that can help them.
And according to the Center for Disease Control, the suicide rate is 45% higher in rural America than what it is in urban areas, and Montana already has one of the highest suicide rates in the entire country.